Mr. President, no one has thought more over a long period of time about health care than you have. You saw that President Obama was able to achieve something historic in ultimately getting the Affordable Health Care Act passed, but he's still trying to work it through and has had a bunch of issues. What, if anything, when you kind of look at the situation, are the big lessons that people who are observing this should take away?
The big lesson is that we're better off with this law than without it. And essentially there are, as nearly as I can determine, three problems, only two of which the administration can fix. One is the enrollment period didn't come off well because the national website wasn't ready. But this happened once before. It happened when President Bush put in the Medicare drug program for seniors, which was not as complicated, but had exactly the same problem with the rollout. It was a disaster. There were people who even lost their prescriptions for their existing medicine, and they fixed it. The next problem is a lot of the states with Republican governors are not taking the Medicaid money. And let me explain that to people watching this. The health care law provides for individuals not covered at work to get insurance, and if they're low income, if they are between 133% and 400% of the federal poverty level for their families, they can buy on the market and get tax credits.
Okay.
That's everywhere, and there's a national site.
Yep.
If they're up to 133% of the poverty level, they're supposed to get virtually all of it covered through Medicaid going to the states. Now, these are for working people, not people so-called on welfare. They're already covered. These are working people who make very limited incomes. The Supreme Court gave the states the right to opt out of that. So the states that opt out of that, there's nothing the federal government can do.
Wait, so the states that opt out of that, those folks aren't covered? So
no.
So if you're making $12,000, $15,000, $20,000 in some states.
So you're going to have, in the states that didn't participate, you're going to have this bizarre circumstance where everybody that didn't have insurance with an income of between 133 and 400% of the poverty level will be able to buy insurance on the individual market. It'll be cheaper than anything they otherwise could have gotten. The prices are lower than were estimated, not higher. They're going to be fine. But the other people are not, so they'll have to go to the emergency rooms. And because they're not carrying money with them, the emergency rooms will be giving uncompensated care. It's going to impose a real burden.
Any kind of Supreme Court challenge, you think, makes sense?
No,
in that sort of case?
That's exactly what the Supreme Court voted to let the states do, to basically make the decision not only to mess with their low-income working people, but to hurt their own hospitals. What I think will happen when this becomes evident, since the federal government was just giving them the whole load, I think more and more states will flip and start taking it like the governor of Ohio has, the governor of Michigan has. I think they'll come along. Third problem is for young people mostly, but not all young, who are in the individual market whose incomes are above 400% of the poverty level. They were the ones who heard the promise, if you like what you got, you can keep it. I met a young man this week who has a family, 2 children, bought in the individual marketplace. His policy was canceled and one was substituted for it that doubled his premium. Now, I asked him, I said, same coverage? He said, yeah. And I said, but are your co-pays and deductibles the same? He said, no, they're much, much lower. So he said, in the years when I use health care, I might actually save money. But he said, you know, we're all young and we're all healthy. So I personally believe, even if it takes a change in the law, the president should honor the commitment the federal government made to those people and let them keep what they got. It's funny, politics is the only profession where people are surprised if you know anything. If you were interviewing me and I were your doctor, you would be shocked if I knew nothing about your gallbladder.